Hello, good afternoon, everybody. In the Women's Mental Health series, which is being organized from January 8th to today, 12th. Today, we have the last talk by eminent psychiatrist Dr. Veena Satyanarayana, Madam. Madam will be delivering a talk on mental health and gender-based violence. On behalf of all the participants who have joined on both YouTube and Cisco WebEx, I welcome Madam to this webinar talk, webinar. And before starting the talk, let me give a brief overview of Madam's academic achievements. Dr. Veena Madam is an additional professor in the Department of Clinical Psychology at the very well-known National Institute of Mental Health and Neurosciences, that's NIMHANS. She provides psychotherapy services for individuals, couples, and families, and supervises young trainees. She has worked on several prestigious national and international research grants on gender, violence, and women's mental health in a leadership role. Much of her research work is also published in peer-reviewed national and international journals of repute. She has been invited as a technical expert by several national and international organizations, including the World Health Organization, in order to participate in their policies and programs in the areas of mental health. With this very brief background, I request Madam to take over and deliver a talk on mental health and gender-based violence. Now, over to you, Madam, for your presentation.
Thank you. Thank you for the kind introduction, sir. So today I'm going to talk about gender-based violence and mental health. All of you may be familiar with gender-based violence because of the kind of reports that we keep reading about in the newspaper and so on. Let me also just share my screen.
Yes, sir. Madam, after selecting share, yeah, please select that application, PowerPoint or screen.
Okay. I'm not able to see PowerPoint here. Let me just...
Okay, ma'am. You are using Mac, right, ma'am?
This is Windows.
Yes,
so
ma'am.
I've just shared.
Yes, ma'am. Your screen is visible now. The
Okay.
window, what we are seeing now, WebEx screen only visible. Now you can switch to that PowerPoint. You have minimized it, right, ma'am? Yeah. Yes, ma'am. Now you can give slideshow.
Okay.
Yes, ma'am. Perfect. Thank you.
Okay. Thank you so much. So like I said, today's topic is gender-based violence and mental health. Thanks to KSTA for inviting me for this webinar, and to all of you for your interest in topics of women's mental health. So first, let's understand what gender-based violence is. Gender-based violence is any kind of violence that is directed towards a person because of their gender. What it also is some genders are disproportionately more affected by violence. Like, for example, in our context, for a very long time, due to patriarchy, women were considered to be weaker and more vulnerable. Therefore, a lot of violence tended to be directed to women. We are also in a world where we are seeing the scenario change. I'm sure all of you are aware of reports that women also are not just victims of violence, they also perpetrate violence. And so we have to understand that today gender-based violence can affect all genders. We also know that India has a very popularly called National Family and Health Survey. 5 is the most recent one, And if you look at the estimates of gender-based violence, we see almost 1/3 of the population that they have surveyed in this National Health and Family Survey have reported spousal violence. They've also reported spousal violence of any type, particularly physical violence during the period of pregnancy also. So one knows that generally violence can be very harmful for the person who experiences it, whether it is male, female. We also have to understand today we are talking about third gender and so on. But violence that occurs during the period of pregnancy, when the woman is particularly vulnerable, is also very important. And I'm sure the earlier speakers who have addressed you have also covered issue of pregnancy, issue of childbirth, and so on. So when I say gender-based violence, I'm referring to different kinds of violence. It is also known to be called intimate partner violence, which is one of the commonest type of gender-based violence. So this is known to have immediate as well as long-term consequences on different domains of health. Now, what are these different domains of health? It could be physical health, manifested due to different kinds of injuries, like let's say pushing somebody against the wall or beating somebody can lead to bruises, can lead to fractures, can lead to even traumatic brain injury, and so on. Sexual health difficulties, we know that there was a time when HIV was really in the forefront because the consequences from some of these sexually transmitted infections were enormous. It was also contributing to mortality, but today we have very good medications to take care of some of these consequences. It also has significant impact on reproductive health complications. So this could be pregnancy related complications, or let's say when there is violence during the period of pregnancy, it could lead to miscarriages and so on. Then, of course, we are talking today about mental health consequences. And so it is important to understand that violence can lead to a host of mental health problems. But what we see commonly affecting people are depression due to violence, anxiety problems, and also what is called post traumatic stress disorder. In short, it is called PTSD. So, why should we address intimate partner violence or any type of violence in health settings? A lot of women present to health settings for physical problems, mainly for physical symptoms that could be caused or it could have become aggravated because of violence. So, it helps address intimate partner violence in an effective way, in a timely way. Women may not be able to oftentimes access very specialized services due to logistic barriers. We know that a lot of people find healthcare to be very expensive. They don't go to healthcare professionals unless things become really bad and they cannot avoid seeing a doctor anymore. So people still face a lot of barriers. Some of this could be in terms of logistic barriers around access, affordability, transportation, so many things. And therefore, it's very important to expand the capacity of healthcare staff to first, consider delivering first level interventions. First level interventions can be done even by non specialists. And so it is very useful to understand what can you offer to a distressed person who is impacted by violence, to make that person a little comfortable and then link that person to more specialized care. So, if this is done in a sensitive and systematic manner, it can be very, very helpful. This impacts the health not just of the person who has survived violence. So, in this case, it's not just the woman survivor, but also her family. The entire family is affected if one person is not doing well in the family, isn't it? So, therefore, the gains are not just for that person, it's also for everybody that that person is associated with and close family members, certainly. So, let's look at who is at risk for IPV. So, when I say IPV, I'm just reminding you again that this is intimate partner violence. violence that occurs by one's intimate partner. It could be a partner, spouse, and so on. So this can happen to any one of us. Violence typically um, can happen to any one of us. Like, let's say all of us have had, probably bad experiences just going about routine life. Sometimes, taking a transportation, let's say going by bus, when the bus is very crowded, in the marketplace, right? So it's very important to understand that this can happen to anybody, and nobody is really completely protected from these kinds of problems in the society. So some women, it's important to understand, may be at higher risk. Now, who are these women who are at higher risk? This could be, let's say, women doing sex work, commercial sex work. These could be women with disability. Disability could be related to one's intelligence. It's called intellectual deficit disorder. It could be mental disability. It could be physical handicaps, right? So these women are typically not in a position to protect and safeguard themselves. Therefore, they become vulnerable for violence, for different kinds of atrocities. So, women with mental illness and related disability, and also minors, children, adolescents before the age of 18 years. So, today in the country, we have a very popular act or a law called POXO. Some of you may have heard about it, and this is essentially for protection of children against sexual offenses. And typically, children before the age of 18 are protected under this act and law. Similarly, we also have a law and act for, let's say, domestic violence, right? This was also carried out to safeguard dowry related harassment that we were seeing quite a bit, and also atrocities of violence in the context of a married relationship. So, the Domestic Violence Act is also a very popular act which protects women against such atrocities. We have to remember that all acts and laws can also be misused. So, today you find a lot of men complaining that women sort of falsely accuse their spouses and partners, and they are sort of shielded by such acts. We have to understand that laws and acts are passed for a majority that may be affected, and there could always be such exceptions where women tend to misuse these acts in their favor. Okay. Plus, we have to remember that this can happen to any act, not just this, right? So, how does one know that IPV has occurred? So, suddenly you come across a co-worker, a colleague, who could have scars, bruises, burn marks. It's very sensitive to ask. Or even if you've asked, they've said something appropriate. Kukkರಿಂದ ಆಯ್ತು, ಮನೇಲಿ ಕೆಲಸ ಮಾಡ್ತಿರ್ಬೇಕಾದ್ರೆ ಆಯ್ತು, it was a kitchen accident, right? And a lot of them also have injuries. Sometimes you get a clear idea only when you do a medical examination, but not everyone goes for a medical examination because they are also worried in this day whether this, will get reported, whether they will get into further problems if, let's say, the doctor reports violence to the police or to somebody, and then the husband harasses her more, then she's at greater risk. So, a woman is at risk for violence, and therefore sometimes it's very important to do a more detailed assessment. And a lot of women, even though they are at the receiving end of violence, completely deny it, either because they don't think of it as a problem, nobody in the family thinks of it as a problem, they're in a neighborhood where this is common, happens in the neighbor's house, happens in their house. So they start justifying violence. And that's what the National Health and Family survey also showed, that a lot of South Indian states, women from these states started justifying and accepting violence as the norm, which can be more dangerous. So typically, how do we assess IPV? The reason it's important to carry out a complete assessment is because we get, first of all, a comprehensive understanding of the problem. It helps us identify risk factors and also some of the strengths that the affected person may have. It helps us design an intervention that will help us address these problems in women and make it a little tailor made for this person rather than giving some generic guidelines. The assessment process, sometimes very sensitively, if you give this person some time, some attention, carefully ask her questions with a lot of sensitivity, make sure you're using, very sensitive language. This whole process of talking to her for 30, 40 minutes itself can be very therapeutic. She feels that somebody genuinely cares, somebody understands, somebody is validating her distress, and that can become very, very therapeutic for the person who has undergone violence. So let's look at what are the different components of our assessment. So typically we want to understand the nature of violence, frequency of violence, how often does it occur, duration of violence, over what period of time this person has been at the receiving end of violence, and also how bad is it, how severe is it. No violence, mild or severe, is acceptable. Let's understand that. But sometimes in evaluation, we need to understand their risk. So we understand how serious this could be. So commonly reported types of violence could be physical violence, which includes being hit, being kicked, beaten, pushed, grabbed, injured. Now, a lot of earlier generations had parents who were very strict, and their way of disciplining children was to hit. But today, parents have become very different. Children are very sensitive, and physical violence is not an acceptable form of disciplining at all, right? Emotional violence. Now, this could be, somebody who gets neglected, who's repeatedly humiliated, insulted in the presence of others, verbally abused, not allowed to meet her family members or friends, gets socially isolated. All of this amounts to emotional violence. Sexual violence, of course, is, participating in sexual acts against her will, getting molested, sexual assault. All of that could mean sexual violence. It's very important to also understand there could be a range of controlling behaviors, not letting them free access to communication. Okay, they are not supposed to use the phone, or if they are supposed to use the phone, you should know exactly who they are talking to, what messages are they sending. All of this became, quite significant also in COVID times, when there was lockdown, when there were a lot of restrictions. So women could not even get help, and they were living with the abuser under the same roof, being at the receiving end of violence. And therefore, at that time, a lot of online ways of helping these women became important, because all forms of violence impacts the mind, right? And sometimes even if the woman is earning, she cannot spend her money how she wants, she cannot buy things she wants. Everything is subject to explanation and justification. So restricting and curbing freedom can also be a form of controlling behavior, like stalking, right? Following them to their workplace, following them everywhere, not giving them freedom of movement, not giving them enough space and privacy, can also be controlling behaviors. So in terms of duration, we typically find out when did violence first begin. A lot of people experience it over different points in their lifespan. They may have experienced it as a child, they grow up to experience it in their marriage, then they grow up to also experience abuse as elderly, in the hands of, let's say, their children sometimes, or their partner, whatever the case may be. So it's important to see to what extent this person has been in difficult circumstances. It's also important to understand the frequency, just to see whether this is like a issue that happens sporadically, issue that happens very regularly in this family. We are not interested in exactly quantifying it. That seems a little insensitive, But just to get a broad idea about it will still be important. The severity of it, have they required hospitalization? Has there been risk of harming themselves, harming others, suicide? When the woman says it is severe, we have to take it to be severe, because it's very hard to say one occurrence of violence is okay, but that one occurrence can be very, very severe. It could have, impacted the person in many ways, physically, sexually, reproductive health could have been affected, and also their emotional and mental well-being. Again, it's very important to understand the context of violence. What do we mean by this? What factors and situations lead to violence? What increases violence in this household? What decreases it? What efforts has she made to protect herself and safeguard her interests? How has she coped? How can people in her environment help her? Have they done anything to help her? What has been the outcome? Is there a pattern that we see? So, one of the common things we say is we have to look at risk and protective factors. Now, a lot of women are in these abusive relationships and they are not willing to come out of it. So, the goal of any counseling should not be to immediately tell her to leave her husband, because the woman is not ready to do that. The goal is always to keep her safe. How can you keep her physically safe? How can you keep her emotionally safe? How can you improve her physical and mental health such that she is in a position to decide what she wants to do about the relationship that is abusive? Okay. We also know that in a lot of cases, alcohol contributes to a lot of these violence in the household. So, to understand whether violence occurs only in this context of alcohol use, does it occur in other contexts also? Does this person have a support system? Now, very many times they have people, they have their parents, they have siblings, they have cousins, but this is such a personal, such a private issue that the woman may not want to talk about it. She may have kept it a secret to guard, to make it less embarrassing for herself, to not feel ashamed, to also preserve family honor. Now, there are a lot of reasons why, even though they have a good support system, they don't talk about it. And sometimes they just lack a support system altogether. Very important to see whether there is increased dependency on spouse, is there illness, disability, financial problems. What could be risk factors for this particular woman? What could be keeping her in such a, challenging circumstance? Was she raised in a family where violence was normal? She saw her father beating her mother, and so she thinks it's okay for her husband to beat her. She thinks the daughter can be beaten by her husband. So, some of this is also intergenerational. It's very important to understand that some women or anybody who's experienced violence becomes at a greater risk for mental health difficulties. Not everybody needs to have a disorder, but they become psychologically impacted. They could have low self-esteem, low confidence levels, generally have other somatic symptoms, right? Or not get married at all because of their early experiences, not be able to trust anybody. So there could be some softer indications of difficulties in these people, even though they don't develop a full-blown psychiatric disorder. Now, protective factors are inner resources of the woman. Some people are very resilient. Some people have a very good support system that keeps them going. So, protective factors are also important to evaluate. Now, this is a typical situation that we see, which is called the cycle of violence. So, typically, where violence occurs in household where alcohol problems exist, you can see that a man comes home intoxicated, is under the influence of alcohol, beats his wife following an argument. That argument can be over anything, like little things trigger them and they lose control, right? They become less inhibited or disinhibited, right? At that time, the wife has had enough of this, wants to return to her parents' house, but it's too late now. So I'll go in the next day, like next morning, I'll probably leave, is what the wife thinks. Next morning, the husband is a changed man. He's completely different. He's profusely apologetic, makes plans with the wife and children, takes them out, makes promises to change, to stop, engaging in violent behaviors and so on. The lady believes that he really means this and decides to continue her relationship with him. And this becomes a loop. So this keeps going on in the household over and over again. So, when all this is happening, why do women stay on in abusive relationships? It's because of fear of consequences. They don't want to um, have a divorce, be separate, be single again. They worry that society will look at them very differently if they don't have the status of being married and have a family. They'll be subject to more atrocities if they become single again. The stigma associated with separation and divorce, cultural norms, lack of support, that this person does not have any support, and so this is the only person, and they think known devil is better than an unknown devil, so they continue. Conspiracy of silence, sometimes they just keep it a secret. Nobody knows. She looks fine from the outside, she's interacting with everybody, but nobody knows that this is what is going on in her personal life. Not knowing sometimes that there are people who can help her, there are NGOs, there are shelters for such women, there are medical facilities and so on. These factors often reinforce or strengthen the cycle of violence. And breaking the cycle is often very critical to help people in these kind of abusive relationships. Now, we also have to understand that there is a bidirectional relationship. Like I said, mental illness is a risk factor for IPV, and IPV is a risk factor for various kinds of mental health difficulties. So it's important to also understand that we carry out assessment not with the intention of diagnosing, labeling, pathologizing the person who is in difficult circumstances. We quite understand that anyone exposed to a very traumatic event like violence is quite likely, it's quite normal for them to develop mental health problems as a consequence. And so a woman should not feel that, we are only interested in labeling her as depression and starting her on some kind of medication, right? Women are less able to protect themselves if they are mentally disturbed. So, looking at mental health problems, these people, whether it's men, women, affecting any minority gender, they can have depressive symptoms, they can have anxiety symptoms, including post traumatic stress disorder. They can have somatoform symptoms, which is like bodily manifestations of distress, aches, and pains, um, certain bodily functions not being okay. People think it's happening because of a physical illness, but actually the reason is stress and mental health difficulties. Substance use could be common, sexual dysfunction, self harm, and suicide could be also very common. So, again, in terms of assessing mental health, we look at the presence of symptoms, their frequency, duration, how severe they are, how much of the person's routine it has disrupted. Due to these symptoms, she's not able to go to work, she's not able to do her household chores, she's not able to do any child care, and so on. So, how much are these symptoms interfering in the person's daily life? It becomes important to assess that and also assess their coping. In terms of suicide risk, which is a huge issue in a country like India, we keep reading again reports about attempted and completed suicides. A recent act, which is called the Mental Health Care Act in 2017, has decriminalized suicide. Up until then, it was considered to be a criminal act. right? And that act was very important to decriminalize it. And so we try to evaluate whether this person has engaged in self harm previously, whether currently she harbors death wishes, she feels hopeless about her future, feels helpless about her situation, expresses desire to harm herself, harm her child, presence of symptoms of depression, actively thinking of suicide or planning, ongoing violence, is she at risk for that, and whether she lacks family or social support. So with this background, I would like to talk a little bit about first level interventions which anybody can do. And so it is important maybe for all of you also to hear about it, so that it could be anybody in your family, it could be anybody in your neighborhood, it could be a friend who's in a difficult relationship, it could be something that's happening in the workplace and you observe it. We are all living in the midst of people and we are likely to encounter this anywhere. And so it's good to know what is it that we can do as a family, as a friend, as a colleague, as just a member of the society to be able to address this. Right? So it's very important to talk to this person by name so that there is that personal touch. Help that person understand that every one of us has the capacity to solve problems. You acknowledge that, you facilitate that, and you provide direction. Nobody likes to be made to feel weak, that they cannot do something, they are helpless. So even in these difficult circumstances, it's important to restore that faith and confidence that they can do something about this. We understand that, right? We are not rushing to decide for them. We are only listening to them. We are facilitating this process. We are providing direction from the best we know, right? So therefore it's important not to rush them, not to make them tell their entire story in the first visit or in your first meeting with this person. This is a difficult story to tell, and it is all in fragments and pieces in the person's mind because she or he is so distressed. So they are likely to take time to trust us. They are likely to take time to believe that we genuinely care. We are not going to take advantage of what they are going to tell us. And so it is very important for us to give them time and proceed at a pace that they are comfortable in. It's important that the woman feels that the counselor genuinely cares and wants to help her. So we have to restore this confidence in the person. Otherwise, why would they, tell us anything? They'll just deny that any of this is going on and carry on, right? We should also not say anything where the woman feels judged or the person on the other side feels judged, right? That you're negatively evaluating this person, right? So very often in the society you hear comments like, it's your fault, you went out at night, it's because of the clothes you were wearing, so many things which actually puts the blame on them rather than on the person who has engaged in the violent behavior. So we should refrain from doing that, because everybody deserves a right to safety, right? Active listening can be very therapeutic, where you're not distracted, you're not busy with your phone or looking at who is going outside, and you're maintaining eye contact, you're looking at her, you're listening, non-verbally you're responding. This is likely to make the woman feel that you care, that you're genuinely concerned about her difficulties and you want to help, right? It helps you ask the right kind of questions in order to provide direction to the conversation. Very important for you to be alert to being alert to what is said, so that you don't, ask the same question repeatedly or make her repeat what she has already told you. Empathy is again a very important word in all of counseling and therapy and patient care. And it's very important for us to put ourselves in that distressed person's position and understand what they may be going through. right? And connect with the woman at that level, and understand what her suffering is like from a deeper emotional level. It's also important to help her talk about her feelings. We do this by asking open ended questions which allow the woman to describe her problems, right? So ask her questions that connect her experience with how she feels, right? How did you feel when this happened? Or what thoughts came to your mind at that time? What did you do? Can you give me an example, right? Very important to validate her feelings, to make her feel like whatever she may be feeling, sadness, anger, resentment, shame, it's quite acceptable to feel all of these things. There is nothing right or wrong about how we feel, right? Because feelings are in some way a little involuntary, right? So anyone in your situation would have felt the same way when you've experienced such difficult circumstances which are very traumatic. It is but natural to feel angry when someone you trusted let you down. So making such statements can further, give her the sense that you understand what she is conveying to you. So these statements tell the woman that you understand, that you're not judging her for feeling a certain way about her spouse, that you support her. A lot of people don't like to talk bad about any family member, right? They feel guilty when they do so. So we also have to be sensitive to these emotions. And as much as this person may be violent and treating her badly, you cannot say directly that he's a bad person, right? Help seeking itself can make a woman feel vulnerable. They expect to hear some words of solace, some hope, some comfort, some optimism needs to be given to them. So, making statements like, I know that it's not easy at all to talk about these issues, but I'm glad that you're trying. And I'm sure you'll start feeling, much better as soon as you shed this burden. Now, while reassurance is okay, false reassurances should be avoided, right? That you'll start feeling much better as soon as you shed this burden. You look much better to me than the first time we met. If it's true, please say it. But if it is not true, if you're just falsely reassuring her, that should be avoided, right? Assure her that you're there to help her in this process, and remember, no false promises, right? We say we use reflections. It's like holding a mirror to someone and reflecting back whatever they are telling you. So sometimes we say, I hear you say that there were times when you felt you deserved to be treated this way. I understand you would have felt in that situation very angry with yourself for trusting your husband over and over again, where you got stuck in that cycle of violence and you went on in that loop, right? So again, reflections like this help them feel understood, gives her a chance. In case you have understood something wrong, it gives them a chance. When they hear you speak, they correct you, they clarify what they meant to say, and so on. Now, for everyone, we say discussing a safety plan is very, very important. Okay. So prepare the client to leave house with kids anytime violence happens. Encourage them to store all their essential belongings in one safe place. Encourage them to take help from friends who they trust. Keep harmful things out of reach. Always keep a number on speed dial of a person they trust so that they can call easily. These days, people are comfortable with sending text messages if they cannot call and the person is also in close vicinity. So then they can send a text message or a voice message also, which a lot of people who are, not very literate can also use. Discuss with them who are the people like NGOs, women's organizations, social workers who may be able to help her, and also the possibility of registering a complaint to be on the safer side so that she is not subjected to further harassment. Now, guilt and shame are very, very difficult emotions to deal with. um, and so it is very important to explicitly tell the person that this is not their fault. It's not because of the time of the day, the clothes they were wearing, so many things, isn't it? Ideally, this should not have happened, right? This should not happen to anyone. Nobody deserves to be treated this way, right? So this cannot be her fault. It's the fault of the person who has done this, and we have to be very clear and explicit to make her understand that we don't think this is her fault, because it's very important that a lot of these people um, feel this way, because the families are also giving them that message that they did something to bring this on. And so we should not keep that same biases and stereotypes going in our conversation with the person who's impacted by violence. In no situation, violence of any form should be tolerated. It's very important that that is also understood. Now, after you sort of talk to her a few times, emotions settle down, she looks a little calmer, she is able to think, she is able to be a little more rational, she is able to plan. So now you're giving, the brain some work, and you're helping her engage in problem solving. Now let's look at what can we do. How can we sort of bring you out of this problem? What is plan A, plan B, plan C? What are the pros and cons of plan A, plan B, plan C? What skills do you need to start putting plan A into action? Now, let's say plan A fails, then what? Right? So, all of this requires a bit of rational thinking. Right in the beginning, you may not be able to do it, but once the emotions settle, it's a good idea to help the person problem solve and figure out a solution to this challenging situation that they're in. Empowerment is important, enabling resilience is important, making her stronger from within, making sure her resources don't become depleted, that, she has these internal resources and also external resources that can be useful for her. So when we talk about support systems, you have self, but then you immediately turn to friends and family whenever you have any difficulty. Sometimes could also be workplace. So let's say, problems occurring in the workplace. We also have an act today called um, protection against sexual harassment or prevention of sexual harassment in the workplace. It's called the POSH Act, POSH. There could be those that are brought into play, an inquiry, and so on. A lot of organizations today have to have that. Referral services again could become very important, that you recognize this person requires more medical problems, you refer to a physician, refer to hospitals. They require mental health support, you refer to places like NIMHANS, which are known for mental health related treatments. They require social, welfare. So you refer to a social worker, NGOs, and so on. They require legal help. You refer to lawyers, maybe to the police, and so on. So support systems could be very many. Sometimes it's also important to handle joint meetings. May not be so much in your context, but in our context, sometimes we have to talk to the partner, we have to talk to the husband, we have to talk to family members. This can also become very sensitive. And we don't do this if we feel that the woman can be put in harm's way. But wherever the woman is comfortable involving the couple, involving the spouse or family, we try to also talk to them. And sometimes, we see them in the context of crisis, emergency, suicide attempt, and so on. So a different way of handling these crises is also carried out. By and large, we should also think of what we should not do, and that is ask questions just to satisfy our curiosity, even if it's of no consequence. Make decisions for them instead of enabling them to take their own decisions. Criticize them, be judgmental, minimize violence, saying it happens everywhere, don't make a big deal of it, trivializing it, forcing the client to talk when they are not ready. forcing them to do things that the counselor feels is right, but the client is still, not convinced. Becoming dismissive about certain self-harm statements, um, thinking that she may be just doing this to seek attention, being very casual about violence, or becoming, part of that secret pact that, you should also not talk about it, which can become very dangerous wherever self-harm, suicide um, is there. So we have to remember that IPV can escalate when the woman is feeling empowered also, because this can happen to people who are very literate, in good jobs, empowered. They suddenly start becoming independent, they earn their living, are taking decisions independently. They're able to put their foot down, they're resisting violence. So suddenly when all of this happens, it can also make violence suddenly increase. Or the partner finds out that, the lady is seeking the help of a friend or a counselor or a family member, then they become angry, not just at this person but also at whoever is helping them. This I've already discussed. We have to always remember this is a very sensitive matter, and these are vulnerable populations, whatever concerns women and children. And so, ethically, we need to keep in mind confidentiality and its limits, safety, uh, minimizing further violence or re victimization, creating awareness, careful documentation, and any disclosure with their consent. Right? So I think I've already taken enough time, and we should have at least some time for interaction. So I will stop here and take up any questions that you may have.
Madam, thank you very much for a very detailed and informative and scholastic talk on domestic violence against women, gender-based violence, I mean. On behalf of KSTA and all the attendees, we are very thankful to you for this wonderful presentation, madam.
Thank you.
Umesh, are there any questions? Umesh? Madam,
Sir, there are no questions, sir.
there are few. What are some common mental health challenges faced by survivors and how can they be addressed?
Okay. So, common mental health challenges are, like I said, depression is one of the common mental health problems anyway. NIMHANS has conducted a large national mental health survey. So, if you look at that survey, which is publicly available, we see that depression is one of the common things, and world over also they recognize, like WHO and all of that also talks about depression to be the commonest mental health difficulty. It's considered to be the common cold in psychiatry, right? 1 in 5 people can develop depression at any point in their lives. Women across the reproductive stages do become vulnerable to depression. Let's say in the time of menarche, they may have mood disturbances, in the time of pregnancy, also in the time of menopause, and so on. So I would say depression, but definitely anxiety problems, like I said, PTSD, somatoform conditions, right? Not presenting with depression, but presenting with feeling of tiredness not going away, feeling of not able to sleep well, not able to eat, they're losing weight. So these are all physical problems, but it has mental health origin to it. The cause could be more psychological.
Madam, next question is, what are some effective self-care strategies that a survivor can deal with in mental health issues in the aftermath of gender-based violence?
Yeah. Self care strategies are important today for every one of us. Like, for instance, some of us, we know that, typically in our middle age, we become prone to several cardiovascular illnesses. So we start exercising, we start walking for at least 30 minutes, We try to eat a good diet because we don't want it to have consequences on our health. We don't want to get problems like blood pressure, diabetes, cholesterol, obesity, and so on. Similarly, all of this lifestyle changes can also help one's mood. So we think we are doing this only for the body, but it also goes a long way to help the mind. So let's say if you play sports, it releases a lot of endorphins in your brain that are likely to make you feel good. So any exercise does that. It could be walking for some people, sports, yoga. All of that is a very good self care practice to follow. Along with that, some deep breathing exercises to just keep calm, pranayama, all of that is also very useful, not just for the body, but also for the mind. It's also important to rest well, sleep well, eat a nutritious diet, right? These things are also important to engage and not become very isolated or just get hooked to mobile phones and devices, but actually meet people, spend time with people, have some social life. That also is very, very important, to spend time with family, friends, and other acquaintances that you may have. Lot of people believe in religious and spiritual practices, so depending on whatever is their religious affiliation, it is a good idea if that brings them some mental peace, chanting something, going to a temple, following some of these activities. That is also known to be very good. So these could be some of the self-care strategies.
Thank you, madam. It was very, very informative. I'm sure many of the audience who have joined both on Cisco FX and YouTube platform will be highly benefited by your talk. Moreover, KSTA will be putting your talk on our YouTube channel, and some of them who could not join, seeing this video later, they also will be educated about mental health and gender-based violence. I'm sure in the days to come, because of campaigns and awareness, gender-based violence will come down. And this KSTA will keep organizing programs like this. In fact, we would like to have one physical meet also in our own campus with experts like you, and coming and explaining how it could be avoided. Most probably in the March or April, we will be organizing a workshop, madam. We will also invite you for the talk. Once again, on behalf of KSTA, I'm very thankful to you for your wonderful presentation and time in spite of your busy schedule. Thank you.
Thank you, sir. It is our pleasure. And thank you for taking the initiative to organize these series of lectures. And we will also be very happy to collaborate with KSTA in future.
Thank you, madam.
Thank you.
I take this opportunity to thank my friend Dr. Bharat Srinivas, without whom I could not have organized this webinar. He is the main person who helped me in contacting all the resource experts. Bharat sir, thank you very much. If you're not there, I will speak to you later. I'm also thankful to all the resource experts. First talk was on gender and mental health by Dr. Geeta Desai. Second talk one was by Dr. Preeti Reddy. She spoke on menstrual related mental health issues. Then the third talk was by Dr. Rashmi Arsappa. She spoke on pregnancy and mental health. And Dr. Sundarnag Ganjekar spoke on mental health of young mothers. And today, Madam Dr. Veena Satyanarayana spoke on mental health and gender-based violence. In fact, it is a very, very useful series of talks. I'm sure many would be highly benefited by this series of webinars. Thank you very much, all the audience.
Thank you.
Thank you very much. I also thank all the resource experts who have delivered very insightful and informative talks. We are very happy to associate with Nimans in promoting such programs in future as well. Thank you.